Before I start, could I have a show of hands? How many people remember the movie The Field of Dreams? All right, good amount. All right, hold on to that thought for a moment. Okay, so the Raindrop Near Vision Inlay is a 2 millimeter diameter by 30 micron thick hydrogel. It's 80% water. It's clear, so it maximizes light transmission. It has the same refractive index as the cornea. It's placed under a femtosecond flap under one eye, and it is removable. Profocal shape-changing technology. You put the inlay down on the stromal bed, the flap back down causes an elevation in Bowman's, an elevation, corresponding elevation in the anterior curvature. The first 24 hours or so, you have epithelial remodeling that takes place, creating a smooth focal gradient. And it's that change in anterior curvature that gives you the improvement in near and intermediate vision. From a regulatory standpoint, Module 1, 2 are closed. Module 3 has been submitted. We completed our GMP audit last week. Module 4 has been submitted. We're in discussions with the agency now. We anticipate a panel in the third quarter, and we're hopeful for an approval in the fourth quarter of this calendar year. Many of you may have seen our peer-reviewed journal article on ophthalmology. We had 93% of our patients were at 20/25 or better, gaining about 5 lines of near. 100% of our patients were 20/25 binocularly, and we had a 92% patient satisfaction rate. Is the market large? Well, let's start with the US population. There's 328 million or so in the US. If we look what we anticipate will be our approved indication of -0.5 to +1, there's about 20 million people in that population, about 8.7% of the US population. Because it is an elective procedure and because it is a private pay, we're going to put a household qualifier on it, let's say $75,000. If you put that filter on it, it still leaves about 13 million people in the United States alone. We have a sweet spot. We know that low hyperopes, +0.5 to +1, do even better. So if we look at that filtered group, 7.8 million people in the low hyperope category, and then again, if you put the household qualifier on it, you're still ranging around 4 million patients. So we have somewhere between 4 and 13 million patients in this demographic in the United States alone. So to borrow from a recent presidential candidate or current presidential candidate, this is a huge, huge market. So back to the field of dreams. If we build it, will they come? Well, we took a look at that with a major strategic partner. We conducted 12 focus groups. We did an online survey of 863 individuals in a quantitative analysis. These patients are emmetropic, phakic, presbyopes. They're willing to pay for a procedure, no previous ocular surgeries. They had a household income of greater than $75,000, and each participant was shown a description of the Raindrop Near Vision Inlay and discussed the benefits as well as its potential risks. What did they say? One, presbyopia they believe is functional. It's a quality of life issue. It is not a disease. You can't call them old or middle-aged. They can call themselves that, but don't you dare call them that. Inlay is friendlier than implant, and Raindrop's design and messaging clearly resonated with this population. So what did the participants say specifically about Raindrop? We had a large number, 56%, that said it was appealing. 73% said it fulfilled an unmet need that they had. And we had a large group, 64% as well, that would ask you, the ophthalmologists in this room who are here, about the Raindrop Near Vision Inlay, if they knew it existed. And if you recommended that they get it, 55% of them would say that they would get it. So this is a very motivated group of individuals. 85% of the respondents had a positive emotional response to Raindrop. 40% anticipated, we had surprise. 17% were joyful. If we look at the word cloud, the larger the word, the more the higher the response. Hope, hopeful, happy, see, excited. This is again a very motivated and a group that would love to have this their presbyopia taken care of. And contrary to popular belief, I've been in this marketplace for 5 years, and I continually am told that presbyopes don't go to the ophthalmologist's office. Well, maybe that's because you don't have a device that fulfills their needs. If you did, 71% of these approximately 1,000 people said that they would seek you, again, the ophthalmologists in this room, they would seek you out. So in summary, large patient population, large unmet need, Raindrop hits an aspirational note of hope, surprise, and joy, and it will drive patients to the ophthalmologist's office. So in conclusion, if we build it, they will come. Thank you very much for having me here today.